Hello, it's Funny Corner back on your screen. Yeah, it's been a very long while because the last time I updated on my YouTube was 3 months ago. So I have to reintroduce myself again. My name is Funny Corner, a nursing student, and on here all I do is simplify health terms, health related topics, things that has to do with women's body and general health knowledge. So today we're going to be dealing on hormonal imbalance. Mind you, if you're coming from my TikTok page, Instagram page, thank you for coming here. First of all, we all know that hormones are actually messengers. All they do is send signals to different parts of our bodies. Example, the estrogen helps regulate the menstrual cycle. The progesterone helps prepare the uterus for pregnancy and ovulation. The insulin helps move glucose to different parts of the bodies. The cortisol helps manage stress, and so on and so forth. Now, when we talk about hormonal imbalances is when an hormone is too much or too low, or rather it's not doing what the body is expecting, like what it normally does. It's not doing it again. The funny part about this hormonal imbalance is that it might be only one hormone that is actually out of balance, but it's going to affect your whole body system because all the hormones are actually connected. Example, too much testosterone in a woman is going to bring out excess facial hairs, irregular cycle, because on a normal, testosterone is for males and not for female. Same thing as cortisol. When there is too much cortisol your sleep pattern is going to be disrupted, appetite, and the rest of it. Same thing as estrogen. When your estrogen is too low, it's going to affect your menstrual cycle and your bone health. Now, how will you know you have hormonal imbalance? Most of the time, some of us think it's going to show up in an obvious way, like you know how someone will be sick, like it will come out in an obvious way and you'll be like, oh, this is hormonal imbalance. But no, the little things you are seeing in your body and you are ignoring it, it might actually be an hormonal imbalances. So the first one is irregular periods, missed periods, that is menstrual changes, which include missed periods, heavy bleeding, less bleeding, like irregular periods. You see it this month, you do not see it next month. That is definitely a sign of hormonal imbalances. Some of us will see it and just think, okay, it's normal, maybe it's probably something else, but it's actually a sign and symptoms of hormonal imbalances. Is it so? Because the estrogen and progesterone, they regulate the menstrual cycle. So any disruption in that hormone, it's what is gonna cause these few things I've actually mentioned under the menstrual changes. Skin changes. Some of us think that skin changes such as oily skin, dry skin, acne, they might just come just because of food. It's not just food alone. Hormonal imbalances is actually a cause of that too. Because hormones such as androgens, they increase oil production in the skin. My list is hair changes. You see, you start losing hair, your hair start cutting all of a sudden, hair thinning, and you'll think, oh, maybe it's because of too much braids. It's because I've braided my hair for too long. Or maybe it's because you'll just be looking for random excuses. But I'm here to tell you that hormonal imbalances causes hair thinning, hair loss, hair changes basically. Not just you braiding your hair. Maybe you would blame the hairstylist saying, oh, maybe it's the hairstylist. I think I need to change the hairstylist. Because why is the hairstylist dragging my hair and it's cutting? Only for you to figure out that it's an hormonal imbalances. That's why it's really, really good to pay attention. This is due to what hormones? Androgen. When there's high androgen levels, it will lead to hair thinning, hair loss on the scalp. Next one on my list is weight changes. You see you losing weight, all of a sudden you start seeing yourself gaining weight more than usual or losing weight. All that could be hormonal imbalances, because weight is actually linked to metabolism, fat storage. Hormones is actually linked to metabolism, fat storage. Hormones help regulate all these things, and when they're disrupted, your weight is going to change. It's either you lose weight or it's either you gain weight. Next one on my list is mood changes. You see yourself having mood swings, anxiety, irritability, depression, and you think, oh, could it be what this girl did to me that made me pissed off? But sometimes, not even sometimes, yes, sometimes it's actually linked to hormonal imbalances. Why? Because hormones influence brain chemicals, involved in mood and emotional regulation. And how would you know if it's actually emotional imbalance? Except the situation was a critical situation where you know, okay, that this girl did something to piss me off. But if it's a situation whereby no one is actually doing anything to you, you're just on your own, but you feel yourself feeling anxious, like feeling irritated, like, oh, ew, what's going on here? You just know it's your hormones that's messing up with you. Often it's sleep problems. You think you're waking up in the middle of the night, it's normal, or maybe it could be because of that dream you had. I'm here to tell you it absolutely has nothing to do with that. Well, yes, it can, but the only way you can tell is how often this persists. How often this persists, and not just how often this persists. Look at your situation. Are you involved in any stress that would involve you maybe waking up in the night? Most of the times you don't even have these bad dreams, but you find yourself waking up in the night often, difficulty sleeping, feeling tired even after sleeping. That is actually a sign of hormonal imbalance, and it's not something to ignore. Next one is low energy, constant fatigue. You know you're not doing anything, but you're still feeling tired. Your body still feels like it needs to rest, but you just finished resting, but you're doing absolutely nothing. So why are you feeling tired? That is actually a sign and symptoms of hormonal imbalances. Yes. Causes of hormonal imbalance. Some of you are actually wondering, but wait, what exactly is causing this hormonal imbalance? And I'm here to tell you the causes of hormonal imbalance. Number one on my list is chronic stress. Yes, you know, you might think that you're going to school, waking up 7 a.m., going to school, the work you're going 9 to 5, like those little things you're doing, you might see them as like it won't show up on your body, but it's actually like, sorry, it's definitely gonna show up on your body. Yes, chronic stress. It's gonna disrupt your hormones. Next one on my list is poor sleep. Sleep helps regulate hormone production. So a situation whereby you're not sleeping enough, definitely you're disrupting your hormones, which will now lead to hormonal imbalances. It's poor nutrients. A situation whereby you're not eating healthy foods, taking enough proteins, consuming healthy fibers, you know, the 6 classes of food. You might think it's not gonna do anything as long as something is inside your stomach, but it's gonna show up. The result is gonna show up in your hormones when you start having the signs and symptoms of hormonal imbalances. That's why let me say this. That's why when people keep asking, how do I treat? Although I'm going to talk about that, I'm going to tell you how to treat that. How do I treat? How do I treat? I keep saying it's not about how do I treat. Ask yourself, what have I done wrong? Out of all this, discussions I'm about to mention, it's for you to ask yourself, which of these am I guilty of, or which of these do I do? From there, you will know how to deal with the treatment. You pay attention to the things you do and be like, okay. Maybe I'm going through chronic stress, I need to reduce that. Or maybe I did not sleep enough, I need to reduce that. That will help you treat the hormonal imbalances. So let's proceed. It's obesity. Excess fat in the body disrupts hormones. Like it's not allowing, like it brings up excess estrogen production, which thereby leads to insulin resistance. So thereby disrupting your hormones and causing hormonal imbalances. Underweight. I know it's funny how I just mentioned being obese and I'm now mentioning being underweight because I'm like, so where like none is better, right? Yeah, as you can see, none is better. The whole point is just maintaining a healthy body size and body weight. So being underweight, very low body fat can reduce estrogen production, sometimes leading to missed or irregular periods. I think that explains itself. So being underweight, that means you're not feeding enough. You need to feed enough. I'm not saying feed to the point to become obese, but feed healthy feeding. That's what we're talking about. Some medical conditions actually causes hormonal imbalances, some of which are PCOS, now known as PMOS, thyroid disorders, adrenal disorders. All these medical conditions, they contribute to hormonal imbalances. Other ones are pregnancy, breastfeeding, premenopause, all the stages, they contribute to hormonal imbalances. How is hormonal imbalances diagnosed? This is something I actually really want to emphasize on. Doctors do not just ask you for symptoms and they proceed, you feel me? They're gonna ask you history about your menstrual cycle, like how is your whole menstrual cycle? Do you see it this month and do not see the next month? Ask for a well-detailed medical history and also blood tests to measure hormone level, pregnancy test, blood sugar test, if insulin resistance is suspected, ultrasound scan if needed. This is the most important ones I know you guys are all waiting for. How his hormonal imbalances treated. I always say treatment of hormonal imbalances depends on the underlying cause. That is why I said what I said earlier. If you can identify the cause yourself and admit, okay, I think it's due to poor sleep, you'll be able to fix it. You'll know the easy routes to fix the hormonal imbalance. Treatment actually includes true lifestyle changes, which includes improving sleep, managing stress, eating a balanced diet. I've emphasized this enough. Regular physical activity and maintaining a healthy weight. Now, depending on the cause, some doctors will prescribe an hormonal contraceptives, thyroid medications, medicines to improve insulin sensitivity, and other therapies. Out of all these things I've said here, I think the time you should really panic or you should go see a doctor, because most of the times you can actually manage this yourself without seeing a healthcare professional. I think it's if your period gets missed for a long period of time, you start seeing facial hairs, which is uncontrollable. That is when you should start, okay, this one is actually out of your hand and you should go see someone, a healthcare professional rather. So yeah, this is actually some things I have to say. Like I said, I'm a nursing student, a 200 level nursing student, and this is what I do, simplifying health related terms, simple ways, and sharing basic knowledge about health, basically health education. So if you guys didn't subscribe to my channel, do so. And this is my TikTok channel name, my TikTok page, and my Instagram page. Please bear with me. I might not really be fluent. I'm still dealing with this. I think with time I'm going to get better. I love you all.